Dr. Alicia Cloete, welcome and thank you so much for your time during this presentation. I know you've been on the media recently regarding brucellosis, so you're the perfect person to address the students and the rest of the attendees today on the topic of brucellosis. So thank you, and we're looking forward to your presentation. If you can just introduce and tell more about yourself to the attendees. Thank you.
Okay, thanks a lot, Elaine, and thanks as well for the opportunity to present today as well. Brucellosis, especially in dairy herds, is a very important disease. I'm from the Department of Agriculture, Land Reform and Rural Development, the National Office, and I work in the disease control section, and I'm very involved with the formulation and the driving of the new bovine brucellosis policy, where we would like to try to get this disease under control again. But yeah, we'll discuss all those aspects during the presentation. So I was asked to present on brucellosis and have we lost the battle? So firstly, before we can attempt to answer that question, we're first going to have to go through some background to understand the disease first. So we'll just do a brief introduction. We'll go through the complexity of brucellosis, why it's important, the current legislation that is still being applied, relevant control measures, the history of the disease, and how we intend to move forward. The students are also welcome to post any questions or concerns that they might have in the chat box, and then we can discuss those afterwards. Okay, so firstly, with regards to dairy farming specifically, this is an industry where you work really hard. So it's both a passion and a business, and it's a great contributor to food safety and security with all the dairy products that we get from milk. And the production of milk needs to be ethical, economically viable, and very importantly, it needs to be safe for consumers as well. So there are a lot of different aspects and inputs required to manage and prevent all your different risks. And obviously today we'll be focusing on disease risk, more specifically brucellosis as well. So this will include disease prevention and management plans. Okay, so bovine brucellosis, it's caused by the bacteria Brucella abortus, which is an intracellular bacteria. And it causes a chronic debilitating disease that slowly eats away at the profit of a herd. Your main symptom that you might or might not see is abortion, usually in the last trimester, but you often see that in herds that are chronically affected, you don't see these abortion storms anymore. So sometimes you might miss the disease if you do not test for it. You may also see weak calves that are born, reproductive problems like retained placenta or an increased intercalving interval. You can see bull infertility, and in your chronic cases, you can see hygromas on the joints of your cattle as well. And unfortunately, there's no treatment available for brucellosis in cattle. Okay, so how do your cows become infected with this bacteria? The most common route is through sniffing or licking of aborted fetuses, placenta, birth fluids, or even live-born calves. During the birth process, this is when millions upon millions of Brucella bacteria are excreted. And as soon as a cow makes contact with those bacteria and it gets into contact with the mucous membranes of the mouth, of the nose, or the eyes, it can be effectively transmitted to the unsuspecting cow. It can also be transmitted through drinking infected milk. So if you have calves that suckle from a cow that's infected with brucellosis, if she's actively shedding the bacteria into the milk, they can become infected. And then, of course, let's say in an area where your cows calved or aborted, if your pasture or drinking troughs or water sources are contaminated by these birth materials or fluids, then your cows can pick up the disease in this manner as well. And then, of course, you also have your intrauterine infection of the fetus. So if you have a positive cow, she gives birth to a live calf, then that calf can be infected with brucellosis. Also contact then with infected cows from the neighbors, and that would once again be, let's say, if there was an aborted fetus or placenta that your scavengers like your jackals have been dragging around, they can become infected like that. And also just remember your bulls can become sterile if they become infected with brucellosis or if you vaccinate them as well. We only vaccinate heifer calves, we do not vaccinate bulls. Okay, so as I said just now, when a cow goes through a birth process or abortion with the placenta and the calving materials that are released and the fluids as well, millions of Brucella bacteria are released into the environment, and your cattle are very curious creatures. And they will go and investigate, and unfortunately this is the main route in which the infection spreads within a herd. We also need to keep in mind that brucellosis is a zoonotic disease, can be transmitted to humans. So in a dairy setup, your farmer, their family, their workers, the veterinarian, animal health technicians, anyone working with these animals or that are in close contact with the animals or that drink the milk from them, unboiled or unpasteurized, are at risk of contracting brucellosis. Okay, so it's through the consumption of raw milk from your infected cows. If you handle the placenta or the birth materials or aborted fetuses from infected cows, you can pick up the disease if you've got cuts on, for example, your hands or your arms, or if you accidentally touch your face, your eyes, or mucous membranes. You can also get brucellosis if you, for example, get a needle stick injury if you vaccinate them. Just remember that both your S19 and RB51 vaccines are live vaccines. So if you accidentally poke yourself with the vaccine needle, or if you got some of the vaccine onto your hands and you accidentally rubbed your eyes, you can get exposed to the bacteria and you can unfortunately acquire it that route as well. And then, of course, through slaughter as well. Let's say if there's a old cow on the farm and she's slaughtered on the farm, very important to wear appropriate PPE when doing the slaughter, especially if it's an infected animal, because when you remove your reproductive organs and your associated lymph nodes, those are sort of your high-risk organs. And if you also accidentally cut yourself with a knife that's gone through those organs, or once again you touch your face, you can become infected as well. So just be careful when doing on-farm slaughters as well. And the same would go for post-mortems. Okay, your symptoms in humans. Unfortunately, it doesn't show very specific signs, so you might not necessarily know that you've contracted brucellosis. It's typically flu-like symptoms with recurrent fever. It can affect your reproductive organs of both males and females. It can cause tiredness and depression. And the disease can also become chronic if you don't seek medical attention, if you're not tested for the disease, and if you do not receive treatment. So luckily for humans, we can treat brucellosis infection with antibiotics. But the important thing is to identify the disease as soon as possible so that you can start treatment as soon as possible to try and avoid relapses. Because brucellosis causes a systemic infection as well, any organ system of a human can become affected. Your heart can become affected. You can get an endocarditis. You can get a spondylitis of the spine. You can get joint problems. So it's not a disease with specific symptoms. Yeah, it shows more generalized symptoms in humans. Just another note there on the zoonotic aspects. If you're ever in contact with a cow or a herd, either with a positive brucellosis status or unknown status, and you suspect that you might have contracted the disease or you accidentally nicked yourself with a vaccination needle, it's very important if you go to a doctor or clinic to inform them of this, that you work with cattle, that you might have been exposed to brucellosis. Also, just to give them a hint towards what to test for, because if you're just presenting with fever and flu-like symptoms, it's extremely difficult for a doctor to try and pinpoint what might be causing it. So always be aware and always give a proper history to your medical practitioner. Also, if you might have accidentally vaccinated or got a needle stick injury from a vaccine, be sure to take the package insert with you as well, because with RB51, your normal serological test won't pick up if you've been infected with the RB51 strain. So once again, the more information you can provide to your doctor, the easier it will be for them to diagnose you with brucellosis if that is in fact the case. Okay, so going back to cattle and the complexity of brucellosis. Very important to remember that brucellosis is a herd disease. Okay, so this just means, let's say you've got 100 cow herd, you tested all of them and 20 out of the 100 were serologically positive. You still regard that whole unit as an infected unit, and the cattle that currently test negative are potentially positive because they might still be incubating the disease. So you put that whole herd under quarantine. With brucellosis as well, it's got a very variable incubation period. For example, your heifer calves born from your positive cows, they might keep on testing negative, negative, negative until they've actually had their first calf. Then they might seroconvert and start testing positive. So it can take quite a while for you to pick up all the true positive animals in your herd. Problem as well is that your cattle may look very healthy, and as I said before, especially in your chronically affected herds, they might start giving birth to normal calves. You might see less and less abortions, and yeah, it's a very deceiving disease. It's something that you do need to test for. The clinical picture is not always apparent. So this just once again highlights the importance of testing the whole eligible herd for brucellosis to determine the status. You cannot rely on testing individual cows to determine the status of the herd. Often you might get faced with a scenario where, let's say, 2 or 3 cows aborted, then it might be a good idea to at least test them first. If they're positive, then of course you're going to have to quarantine the rest of the herd and test. But let's say, for example, if they're negative, you can't make a comment on the brucellosis status of the rest of the herd just by testing those 3 cows. Okay, so then just with regards to testing for brucellosis, so initially, let's say if it's a herd that you're testing for the first time, you're going to do blood tests twice, 2 months apart, and you need negative results on both those tests to get a TB or CA3 declaration to say that on these 2 dates your herd was tested and they tested negative on these dates. Unfortunately, it can't be used as a forever guarantee that your herd is going to stay negative because there are a lot of biosecurity measures that you need to have in place and keep in place to prevent the disease from entering your herd. Okay, so we start off with your serological tests. You first do your RBT screening test, which is quite a sensitive test. If there are any positive results, those positive samples are then tested with your complement fixation test to check if they're truly positive. We can also make use of milk ring tests, which are also highly sensitive from your bulk tank samples. And then, of course, if any of your screening tests, your serological tests or your milk ring tests come out positive, it's very important with those positive animals, if you send them for slaughter, that you collect the relevant organ samples for culture, because it's very important to culture confirm the organism in the herd so that you know what biovar you're dealing with as well. It's also possible to culture milk samples to try and isolate the brucellosis organism as well. And then also just remember, once again, you first need to know what or diagnose the status of the herd as a whole before you can then go back to the individuals and decide if they're currently testing positive or negative. Okay, and then this triangle to understand the disease and the test better, I got from Western Cape Veterinary Services. Okay, I'm just moving my cursor around. Okay, so if your whole triangle is your herd, your animal population, and let's take that example again of 100 cow herd, and let's say 20 were positive on the test. So this would be the small triangle at the top here, would be the animals that are currently testing positive on your serological test. Now you need to keep in mind that obviously there would be some animals that are still incubating the disease, so they're in actual fact positive, but they just haven't seroconverted. You haven't picked them up on your serological test yet. So these are your false negative animals. So this is this bottom part of the small triangle. And this would be an example here of the total number of truly infected animals in the herd. So those that have tested positive and those that have not seroconverted yet. And then you also need to remember that, as with all tests, you might have a very, very small percentage that test false positive, that are actually truly negative, but unfortunately they cross-reacted on the test and they might show up as a false positive. Usually this will either be absent or be a very small amount of animals in your herd. in this scenario. So yeah, just remember, if you pick up positive animals in a herd, it's usually just the tip of the iceberg. Okay, so then asking, let's say, especially because you can't always see the disease, the cattle otherwise seem to look normal and healthy, why should your dairy farmers then care about brucellosis? So firstly, unfortunately, current situation in the country is there's a very high risk of acquiring brucellosis into your herd if you're not very careful. And that's because of current very low vaccination rates throughout the country, low testing rates, especially in your beef and communal sectors. And also, unfortunately, there isn't movement control for cattle, except obviously with your other disease controlled zones like your foot and mouth controlled areas. Okay, and then also, once again, why should dairy farmers care? Because there is a lot at risk. The health and the production of the dairy herd is at risk. The health of the farmer, his or her family, the workers, and also the veterinary professionals are at risk. And then, of course, and also very importantly, your farming operation is at risk in terms of profit generated and potential growth as well. Just showing you this map, I showed it during the Control Diseases Week as well. So this is the reported bovine brucellosis outbreaks for the last 5 years. It's just more than 1,000 new herds that were identified as infected. And also keep in mind that this is an underrepresentation of the true amount of positive herds, because there would be many herds that have not been tested yet. And also some herds that are tested are not always effectively reported to the responsible state vet, or the responsible state vet doesn't always report it effectively to the national office where we consolidate the data. So as you can see, basically where we farm with cattle, unfortunately, brucellosis is a real risk. Okay, we'd just like to go through some typical risk points just to give you an idea of how farmers often acquire brucellosis into their herd. And the thing that pops up most often, and to me it's actually really sad, is farmers often buy in the infected cattle without knowing what the status of the animal is, and without even asking about the brucellosis status. So in other words, you actually paid good money to get a very dangerous disease into your herd just because you didn't ask about the brucellosis status. I would equate it to buying a car without seeing a roadworthy certificate for the car. I think it's also just a habit that we need to get into, is to educate farmers to ask questions. You know, if you're going to spend money on, let's say, replacement animals or bulls, make sure that these animals are really healthy and that they will benefit your herd and not unknowingly bring extra diseases with them. Another thing that often goes wrong is farmers tend to sell your individual test negative animals, and you get situations where a farmer is actually under quarantine for brucellosis, and then of course there are some animals within that herd that will still test negative, and then they just test those ones again. You see negative results for those five cows, and then they sell those 5 animals with the negative test results without disclosing the true status of the herd. So in that circumstance, a farmer will unknowingly buy in potentially positive animals. So that just shows the importance as well. You know, farmers should also ask the right questions. You can't just go on the status of the individual cow. You need to go on the herd status. What's the status of the herds where the cows or the bull is originating from? Okay, and then just once again to keep in mind for your herd status, you need to test the whole eligible herd, and you do that twice, 2 months apart. Okay, and then obviously your auction is typically a risk point as well. And also we need to start looking into better vendor declarations. Farmers need to ask for this, and we need to attach the appropriate test results as well if available. Okay, speculators as well can potentially be a high risk, especially if all the correct information is not disclosed. Then you also need to keep in mind, you know, what is the status of your neighboring farms? Are you perhaps sharing grazing? Are you perhaps, you know, overlapping with certain fields? So you need to be aware of the status of other cattle that your cows could potentially come into contact with. Also very important, often your dairy farmers also have separate beef herds, and it's important for them to know as well what the status of the beef herd is that's running on their farm, because you don't want to acquire brucellosis into your beef herd. At some point you swap their grazing fields, and then through contaminated pastures you could potentially spread it to your milk producing cows as well. So basically, if you summarize all of this, the big thing you have to look at is basic biosecurity to protect your dairy herd. Okay, so obviously within a dairy, if brucellosis is present, your infection pressure will be very, very high. And this is because your dairies are very, very intensive production system. You have very close contact of your animals, either in the camps or once they go into the milking parlor. So it's not like an extensive beef grazing system where the animals are far apart. Your dairy animals are in close contact, and it's much easier to spread the disease this way. It's sort of easy for the camps to become contaminated, potentially your milking parlor as well. Let's say even just with vaginal discharges or with infected milk. Then also keep in mind things like communal udder cloths are obviously a no-no. Also, your milk clusters need to be disinfected. Any equipment that you use on the cattle need to be properly disinfected between uses, so that you do not potentially spread brucellosis. Also, your dairy cattle also have more frequent contact with workers compared to your free-ranging beef cattle. So your workers also need to be aware of basic hygiene, disinfection between working with different animals, so that they don't act as fomites or vehicles for accidentally spreading the disease to other cows. So here, once again, your biosecurity and prevention of the disease are your key points. Okay, so then also very, very important in a dairy herd is your economics. Okay, so if you have brucellosis in your herd, and let's say unfortunately you faced a big abortion storm, it means that you would have less calves born and you would have less replacement heifers to push back into your herd. Let's say you have live births despite having brucellosis, they might be weaker calves that might require extra inputs. If you have your cows that suffer from retained placentas because of brucellosis, you need to give them additional treatment. If you treat them with antibiotics, you might need to keep them out of the milking parlor for a while, just stick to the withdrawal period, or you can at least not use or sell their milk. Then also keep in mind with your brucellosis infected cows that the bacteria can be shed into the milk and the colostrum. So if you're going to feed this to your calves, you'll be spreading the disease. So also with your infected cows, you're rendering their milk and colostrum unfit for use unless it is pasteurized or boiled. So if you have a brucellosis mastitis, you're going to increase your somatic cell count as well, and that will be picked up in your bulk milk tank samples. You can potentially also increase your intercalving period, and especially in a dairy where you need to be very diligent in terms of your reproductive cycles. When you're going to artificially inseminate your animals, you're working with very, very narrow margins. So if you're going to sit with an increased intercalving period, it's definitely going to affect your economics and your turnover. Brucellosis can also cause a decrease in milk production. Once again, that's going to affect your profit. Then also, so these are all the effects of the disease on your animals, but then you also need to take into account, if you have brucellosis in your dairy herd, what is the additional cost of your quarantine measures, the fact that you cannot sell animals out of your herd. And then also with your positive reactors or your infected cows, these need to be slaughtered. Obviously, it means that you're going to have less cows in your herd then that you need to replace again. So these can have devastating effects on a dairy herd. So once again, this is why it's much better to prevent the disease instead of trying to deal with it through not being careful with contracting the disease in the herd. Okay, so let's just look at the brucellosis requirements within a dairy. As with all cattle in the country, vaccination of your heifer calves between 4 to 8 months of age is legislated. It's compulsory. You can use either S19 or RB51. Obviously, with RB51, this can be used to boost your older non-pregnant cows as well. But between 4 and 8 months, it is legislated you have to vaccinate those heifers. And remember as well that no bulls should be vaccinated because it can cause them to become infertile. Okay, and then your brucellosis status of a dairy herd needs to be known. It's required by the milk buyer to have negative results for brucellosis and for tuberculosis as well. So once again, your eligible herd will be tested twice, 2 months apart with serological test. CA3 or BR3 certificate or declaration will be issued by the state vet, and thereafter you can go over to your monthly milk ring testing, but you still need to repeat your herd serology at a minimum every second year, or if you find any suspect milk ring test results. So you just need to remember that the milk ring test is done on your bulk tank samples. So this could just be an early indicator of potential disease if you pick up positives, but it's still important to know what the status of your herd is as a whole and also your individual cattle. So it is important to repeat your serology again. Okay, then just a quick note. I know we're talking about brucellosis today, but never forget about tuberculosis. This is also a chronic and erosive disease that can wreak havoc within a dairy herd, and it's also a zoonosis that can be spread through raw milk. So same thing usually when your cattle are tested for brucellosis, they're tested for TB as well through the skin test, because you also need a TB3 declaration to sell your milk. And with TB, you'll retest your herd every 2 years, or if there's any suspicion of disease, you can retest again earlier. Okay, so let's just quickly run through the current legislation with regards to brucellosis. Okay, so brucellosis is a controlled disease under the Animal Diseases Act. And in the animal diseases regulations, we've got table 2, which describes your very basic control measures for the disease. And this includes the compulsory vaccination of your heifer calves. Then we've also got the bovine brucellosis scheme of 1988. At this point in time, it's a voluntary scheme which aims for control and eradication. But as you can see, 1988, that was written quite a while ago. And it is something that we need to revamp, and that's the purpose of the bovine brucellosis policy we're working on, but we'll talk more about that later. Testing becomes compulsory once your herd has been identified as brucellosis positive, then it falls under government control so that there can be continued testing, and then the farmer should cooperate by having those positive animals slaughtered so that they can remove that source of infection out of their herd. Okay, then we've also got the interim manual for brucellosis in cattle. I know this was shared with you during your control diseases week as well, so I just gave you the link as well if you should need it. Okay, so let's just go through the control measures for if brucellosis has been diagnosed in a herd. Okay, so for your infected herd, your property is placed under quarantine. And this is not to punish the poor farmer. This is just to make sure that animals that are positive do not leave that farm and potentially spread this disease to other farmers and to other herds as well. So here, no animals may move onto the quarantine property or off of the property, only if they're going to be sent for slaughter, and then only under the cover of a Red Cross permit received from state veterinary services. So then in an infected herd, you'll test every 6 to 8 weeks, so every 2 months, to try to pick up any additional positive cattle. And then the ideal is, as soon as you pick up any positive cattle, to have them slaughtered as soon as possible so that they cannot spread the disease further within your herd. Okay, so once again, quarantine is there to protect other farmers and to prevent the spread of disease to other herds. Okay, so in your infected herds as well, your positive cattle are C branded on the right-hand side of the neck. And once again, this is not to punish the poor farmer or the poor animal. This is just to protect other farmers from buying these animals unknowingly, because a lot of people are sneaky and will try to sell animals out of an infected herd. So if all your positive animals have been C branded, it's a disincentive for someone to sell these animals. And if they should ever appear at an auction or at an abattoir, at least people should know what that C brand means. So it also just shows you how important awareness is, because if no one knows what the C on the nose is. So also, once again, important for us to actually means. Okay, it's important as well within your infected herds, those cows that have tested positive, to keep them separate from the animals that are currently testing negative, so that you don't get potential transmission to those cattle. Also very important, if you have positive cattle on the farm that you might not be slaughtering immediately, do not allow positive cattle to calve on your farm. If you do this, they release millions of bacteria into the environment. You can contaminate your pastures, you can contaminate your milking parlor, depending on where they've calved down. It's just a dangerous practice. So ideally, if it's an early pregnant animal or not pregnant yet, should rather be slaughtered as early as positive. If the animal is heavily pregnant, if you have a separate calving camp, or even more ideal, an area with a cement floor where she can be kept to calve down that you can clean afterwards, at least you're then trying to mitigate the risk. But yeah, a pregnant positive brucellosis cow is a very, very dangerous animal to have on your farm. Okay, then another thing that's important to discuss with a farmer if they've got an infected herd is the slaughter of heifers that are born from infected cows. I mentioned earlier as well that these animals, let's say they've been infected in utero, they often keep on testing negative until they're pregnant in their second trimester, or often only after they've calved down do they then actually seroconvert, and then their true status becomes known. So a lot of the times, if farmers decide to keep these heifers from infected cows because it looks like they're testing negative on your serological test, you often see a 2-year breakdown syndrome where you've gotten rid of your other infected cows, but now once your heifer has calved and she has shown her true status, she's seroconverted, then she's already spread that bacteria through, that first calving that she had. And then you can sort of go back to square one again, where you will have other cows that have been exposed to this heifer, when she gave birth, and then she might have spread the infection to other cattle once again. So if a farmer can afford it, it is actually better to rather get rid of the heifers that are born from these infected cows, or if they're really adamant on they want to keep them, have them calved down and test them to see if they're truly negative or not, then they should be completely kept separate and handled with care, so that you do not put the rest of your herd at risk. Okay, so getting rid of brucellosis within a herd, especially within a dairy herd, is a very, very expensive and a very intensive exercise. It can also take very, very long. In a good case scenario, it would often take you 18 to 24 months in a good case scenario to get rid of brucellosis from a herd. And that's not obviously through your test and slaughter. Let's say if you have a small herd of 20 cattle and 16 are infected with brucellosis, it would be better rather just to slaughter all those animals, disinfect and start from scratch. So yeah, if you're going to go through test and slaughter, 18 to 24 months is a very, very good case scenario. So this becomes quite an expensive exercise. So once again, this is why prevention is better and a lot cheaper than cure. And this is the message that we need to preach to farmers, is rather put measures in place to prevent this disease instead of having to deal